Welcome to Partially Plastic. Nobody you are about to hear or have just heard is licensed to provide medical advice, nor has anyone examined you for your individual conditions. Please seek the advice of a medical professional of your choice for your treatment. The opinions expressed on this program are personal to the person expressing them and not necessarily the opinions of the host or any sponsor, and are merely anecdotal stories of our individual experiences and not meant to be statements of fact.
Hi, welcome to the Partially Plastic podcast. I'm your host, Kelley, and we're here with Ari. Ari, tell everybody about your business.
Hi, Kelley. Thank you for having me. Well, my business is post-op recovery, surgical recovery, and I am based in Miami, but I do have licenses in other states and what we do is we cater to all post-surgical recovery and all plastic surgery recovery for girls who come here to Miami to take care.
And the name of your business is Massage by Ari, right?
The name of my business is Massage by Ari, and I have been a licensed massage therapist for over 13 years now. Since 2010, I've been a licensed massage therapist and taking care of countless amount of girls.
And I know you're in Orlando and Miami. What other areas do you service?
I'm actually licensed in Florida, New York, New Jersey, Massachusetts, Pennsylvania, Virginia, Georgia, Texas, Alabama, Las Vegas, California, so Illinois, and also Idaho.
So you invented and patented a tape method. Tell everybody what the tape method is.
Okay, in layman's term, everybody started calling it the tape method, but it's actually the name of the patent. It's surgical recovery tape method. And the tape method is a means of compression as well as an aid in the retraction of the skin. When we first started, it was more to help all of our dolls to get their stomach, just to get the inflammation and get all that excess fluid out of them. Because of the fact that when you have that excess fluid and you have excess skin, when that creates a pouch that if the fluid is not drained out with a JP bulb or by incisional drainage, what happens is your body has to metabolize that. So my first intent with the tape method was to help with the aid in the inflammation, because the tape was, I without going into like an over explanation, the tape was made in 1974, was invented in 1974 by an RA doctor to treat his arthritic patients. And this helps with inflammation of the joints. Then it was more publicly or acclaimed to start doing kinesiology with patients or clients, because at that point they were not patients, they were clients for sports enhancement, to help to lessen the fatigue of the muscles. And I started working with athletes. After a while, I started to see what it could do with the athletes that had just had like knee surgery, shoulders, elbows, hip surgeries. And I started utilizing it in the plastic world.
You're the only one with a patent for this method. Can you tell us about the process for patenting it, how difficult it was, and why you're the only one with the patent?
Well, what I did was I patented the technique itself, the technique of getting all of getting the stomach retracted. I have it patented with stomach, arms, thighs, and for the back as well. And I did a 4-year research on working on every patient that I saw, every patient that I had that had to do with plastic. I had an extensive amount of research to defer in the technique, the strength, the halt of how much I could pull, how much I could retract, how much it retracts every single time, and what the effects of the tape was. Then I put it into the US Patent Office, and that took about 2 years for them to give me the patent, giving them specifics, research, videos I have about 75 videos of how to put the tape in different ways and how the tape helps and retracts, and the different instructions on how to do it. All of these engineers, they're engineers. They're sitting behind a desk. They're not massage therapists. They're not physical therapists. So they do not know exactly what the tape was going to do. They just saw the drawings and the videos that we sent in. So we had to basically break it down to them step by step, everything how it needed to be done. So it was a lot of back and forth. Like I said, from the time that I inserted my patent to the time that I was given it, it was 2 years, but I had been working for 4 years before that. Before inserting the patent, I had been doing it for 4 years.
A lot goes into that to getting a patent, so that's a really big deal that you were able to do that. That's great. How does the tape method differ from traditional post-op healing?
Okay, it doesn't differ from it. What it does, it enhances, because now you're not only having something that this tape method, how it works is it's helping with the inflammation. It's helping with the secretion of all of the excess fluid that the body creates. Not only the body creates, but the fluid that they put in our girls when they get the surgery, because lipo is they put additional fluid in you to be able to extract all of that fat. So this is something, it's not a substitution, it's in addition to. It helps a lot, and you could actually massage on top of the tape. It has to be dry massages. It's just like if you were doing a massage on top of clothing or on top of the garment that they put on you, just to stimulate the senses.
Would it be fair to say that the tape method speeds up healing?
It does. It does speed up healing. Not on everybody, but it does speed up healing because it helps with the inflammation. Also, remember, after surgery, it takes about 3 months for your lymph nodes to retract back and to reconnect with its sources. So now, by having this tailored to your own body and necessity tape, that it's a compression garment, but it's a compression that is personalized to each and every patient. What this does now is it helps your body react to it and your skin to retract nicely and in the proper way.
So there's a video on YouTube for just about everything. Can you tell everybody the dangers of trying to do your tape yourself?
Well, this is a funny story. Yesterday I met someone who did a chat with me. She did a video chat with me because she was not here in Miami. And this is something that I do with all of my girls. It's a FaceTime chat where I teach them how to do it themselves. She was telling me about a friend of hers that did it. The dangers of doing it yourself is because you're not prepping yourself. You do not know exactly how what your specific need is. Remember that kinesio taping, it's not the same as the surgical recovery taping. There are different techniques. This is why I was granted this patent, because it's not the same technique as putting on the tape when you have an injury in your ankle, your shoulder, your back, or your hip. This is something that is personalized to each person, depending on where their incisions are, the method that the doctor used with their surgery, as well as the technique. Everybody's incisions are not in the same place, and not everybody's skin creates the same fold. So this is something that, if it's not seen by a professional, could be very dangerous.
Now they have waist trainers. Could you use the tape method as a waist trainer?
Okay, this is something that I saw, and it's completely, remember that the tape method goes directly on your skin. This is something that you cannot wrap as if you were saran wrapping yourself. The tape method needs to be done in a method where it goes with your lymph nodes, so that it helps your body dispose of all the excess lymphatic fluid that you have. So it can be used as like I said, it's an aid in the retraction, as well as in the lowering inflammation, but it cannot be used as a waist trainer, because it's not something that you could put on and take off the same day.
That definitely makes sense. Would using the tape method lessen the appearance of a scar for somebody who's had a tummy tuck?
Actually, no, but I do have another method for people who have keloid underneath the skin and fibrosis underneath the skin with the tape method. This is this is another technique that I use myself for patients who have fibrosis, have created excess fibrosis, scar tissue, as well as some sort of keloid internally.
Who's a good candidate for the tape method?
Basically, most of my patients are good most plastic surgery are good candidates, as long as they don't have open, it's an open surgery, meaning tummy tuck, breast, internally before it heals external. Excuse me. That needs to heal internally before it heals externally. So sometimes the outside looks like it's perfect, it's good, but internally you have not done yet. So by placing the tape, you could be causing more damage and creating a source of keloid and not even know it. You're creating additional scar tissue internally.
So would you say the tape method is used mostly for BBLs?
The tape method is used mostly for liposuction. BBLs is something, BBL is an addition to liposuction. In order for them to do the BBL, to transfer the fat to the glutes, you need to have had liposuction done, so that fat could be grafted and put it in the glutes.
What material is the tape made of, and how do people know if their skin is sensitive to it?
Well, what we do tell everybody is we send them a link if they ask a little bit more when they're doing research. I'm very open, and I show you guys which tape I use. The only brand of tape I use is rock tape, and it's because it's latex free. It's a cloth like with adhesive, but it's latex free. So that's the only one I use, because with the additional compressions, garments, and everything else that you have to put on after surgery, you do not want latex that is going to cause any additional irritation. We send a link if anybody reaches out to us and tells us what kind of tape we use. We send them a link on Amazon, and they could buy it and they could try it on any area in their body, and they could see if they're allergic. We have had a lot of allergies, but like I said, I did my research for 4 years in different brands of tape, different types of tapes. So this is why I concluded in rock tape being the best option for post-surgical recovery.
That's awesome that you give people the option to order the tape and test it before, so they don't get taped up and then find out that there's a problem.
We are always we're very open about the products that we use in the office, as far as the lotion. Our lotions are 100% organic, no preservatives at all. And the tape that we use, I try to have the most branded ones so that they see exactly what I'm using, so they know. So it's not like, oh, you just put something on me. All of my tapes have the brand of rock tape on the back, and the girls are able to see it there when they come into the office.
Can the tape method be used with a faja, or is it a replacement for the faja?
No, it's not a replacement. It's an addition to, not a substitution for. It has to be used with any compression garment that you choose to use, whether it be faja, the waist trainer, a vest, anything that you're going to use as a compression garment. This is an addition to.
What do people need to do to make their tape last longer and get the most out of the tape method?
Well, what we give them a list when anybody comes to us, whether it's via our video chat or our in-office services, we give them a list of aftercare instructions. They should always wash up and dry it. Make sure that it's dry before they place the faja or any compression garment that they're going to put on.
Can people shower with the tape on?
Yes. The tape is supposed to stay on for 5 days. So yes, you do shower for 5 days.
Thank you so much for being here with us on the podcast. I appreciate you. I actually used Massage by Ari when I had my plastic surgery, and it was a great experience. That's how I found her. The people showed up on time to my hotel, and they were amazing, very trustworthy. Everything was great. So I highly recommend Massage by Ari. Thank you so much.
Thank you.